Hello, fellow Pops. I'm Dr. F Scott Feil, and I'm bringing you a message from our sponsor at Ice Shaker. My diet's always been a little bit messed up most of my life, and I recently started trying to take back control of my health. And one of the issues my doctor pointed out was that I needed to make an increase in my protein intake. Now, I can't eat chicken breasts all day, every day, so protein shakes and powders have become a big help. Ice Shaker and its built-in removable agitator is an amazing product. They come in a bunch of sizes and colors, and you can even get inscriptions and logos on them. They're stainless steel, double wall insulated, and hold ice for 30 plus hours. If you're interested in purchasing one, you can click on the link in our show notes. Or if you're interested in selling them for your business and making commission, and let's be honest, if you're listening to the Professors of Profit vlogcast and you can consider yourself a pop or a professor of profit, you're likely interested in selling these as a side hustle. You can click on that link in the show notes as well. Or you can reach out to me directly on social media. I'm pretty available there. I love Ice Shaker, and I'm betting you, your patients, and your clients will too. Ice Shaker, let's shake things up. Now let's start the show. Hello, everybody, and welcome to another episode of the Professors of Profit vlogcast. I'm your host, Dr. F Scott Feil, and I've got with me today a very special guest, Lauren Hebert, who actually was the person that I reached out to many, many years ago when I first started working for a workman's comp company that did not want to do any front-end education for workplace assessment. And I knew for sure that it was a good thing and it should be done. And they just didn't want to do it. So I said, all right, well, I got to figure it out myself then. And luckily, Lauren had been doing it for many, many years. So I reached out to him and got started. Lauren, tell us a little bit about your journey to where you're at today and what you're up to.
Well, I've been doing this particular specialty for this summer, it'll be 40 years.
Wow.
Old. It started when I was a department head at a small community hospital. We had a heavy industrialized community, small town, but everybody worked for a living, and thus a lot of worker comp-based injuries. We would treat them, we'd get them better, we'd send them back to work, and about 90% of them would suffer a re-injury. So I figured we were missing something here. So I began following these individuals back to the workplace, trying to determine why they were getting re-injured. And it became so blatantly obvious to me as to why they were getting injured in the first place that it was a no-brainer that they should be doing various things to prevent that from happening. Like you had mentioned, your workers' comp clinic, maybe they could see the handwriting on the wall that we could be effective enough to bite into their business demand on the treatment side of things. And that's how it turned out. So I began following these individuals back to the workplace. I'd then go to their supervisor or their HR manager and say, look, it's pretty obvious why they and their coworkers were suffering an epidemic of overuse disorders of the upper extremity and lower back. I said, some really simple tips should make a big difference. So they gave me time to, after analyzing all the jobs and identifying the musculoskeletal risk factors, was to develop a 2-hour seminar teaching people how to avoid these problems. And like I said, that was back in 1982, 83. And so we did a couple of factories in our community. One was a fish packing plant. The other was a shoe factory. And they immediately started seeing a big drop in their claims. And over a 1-year period, after doing, I think about 5 or 6 in the first year, they were running 80, 90% reductions in lost work days. Now, granted, back in the 1980s, it was low-hanging fruit. Everybody was profoundly ignorant about workplace injuries. The management standard was everybody is faking, so we'll screw on them as hard as we can and get them to stop doing it, which, of course, is another issue that I needed to straighten them out on. Only a small minority of these are actually being faked, and the emotional reaction of losing your ability to earn a living is what they were mistaking for malingering and all that stuff. So anyway, we were getting some really good results, and like we started at the Bass Shoe Factory, and their peers among their professional group at Dexter Shoe and New Balance Shoe and all the other shoe factories caught on. So I started doing one shoe factory after another. We did 7 Dexter shoe factories and in Massachusetts and Maine, and they saw like an 80, 90% reduction in lost work days. So it just blossomed. And when I approached my medical center, I said, we should be doing this as a service. And they said, nah. I said, okay, screw it. I'll do it myself. So I did. And it took off terribly, terribly fast. And at this point, I have done a little over 500 workplaces, and I have put over 100,000 workers through our MSD, musculoskeletal disorders school, kind of a spin-off of the old traditional back school, only plugging in the upper quarter on a separate issue from the lower quarter. And I was teaching both classes, and we were getting dramatic results. Now, people have smartened up. The stupid managers have gone out of business since then, and the smart managers have been implementing these types of things. So now 90% of my clients are repeat customers, just bringing me in to bring up to date their new workers and to retune their existing workers for review classes. And it's done extremely well. And the key, I've done a lot helping other therapists get into this business. It's kind of my mission. Every one of them is saying, well, I want to go to this factory over here. They got 2,000 workers. That'll keep me busy for a year or two and make me very, very successful. I'm telling them, don't do that. You'll spend the first 2 years going to committees, trying to fight through the bureaucracy. Just focus on the workplaces that have anywhere from 20 to 200 employees. That way, when you go to make a sales presentation, you're talking to the person who actually makes the decision. And a week later, you're back in there doing billable hours. So using that approach, people got started on this quite successfully. Then the other startup strategy is focusing on office ergonomics as a way to get yourself into it if you're a novice, and as a way to relate to practically any workplace. They all have office staff. So targeting office ergonomics is a great subspecialty into this. I mean, there are only so many ways to put buttocks on a chair and hands on a keyboard, and that's what you're focusing on. Did that answer your question?
Yeah, absolutely, man. That's exactly how I got started. It was small businesses with, like you said, under 200 employees or so. I talked to their HR person who brought me directly to the decision maker. And then it was a matter of, hey, would you like to lower your workman's comp costs? And absolutely, yeah, we'd love to do that. All right, great. I mean, it's a no-brainer for them, because workman's comp, can run, one case even can run anywhere in the $4,000 to $8,000 range, and those are kind of conservative estimates. So you save them one case, your time is well worth what it is for you to come in and do that for them. So,
well, that project I did for Dexter Shoe, they paid me about $60,000 for those factories, myself and one other staff person doing it with me, and they saved $4 million in the first year. So I don't think I charged enough.
Yeah, right. Exactly. Well, speaking of that, let's talk a little bit about, why people in the medical field, physical therapists, occupational therapists, doctors, the like, why should they look into something like this? Why should they look into a program like this that can help, businesses and other companies kind of figure out, proper lifting and proper techniques and really workplace assessment for injuries? Why should they look into this as maybe a side gig or a side hustle or getting started on this?
Well, if you're in a private practice, right up front just how much of a screwing we're all getting treating patients, and it's getting so much worse. It's going to be a disaster. The system is in the midst of collapse. I've got patients who need to see a specialist and they can't get in for 6 months. That frustration plus the financial side of it, they want to enslave us. This is strictly private pay. I charge $300 an hour. I collect 100% within 30 days. I'm not billing any insurance company, so I'm not giving any kickbacks to them, which is basically what we're doing in the clinical practice. In order to see their patients, we have to take big discounts. And I'm not going to do that anymore. I think that's totally unethical. So in this type of a format, you've got the best of several worlds. I've done this full time with a staff of 3 other therapists, where we were marching across the country and knocking down all kinds of companies, grossing $1 million or more a year on a full-time basis. Versus I've also owned my own clinics over the years, and this has always been a real strong side gig. Probably a third of my income for probably 20% of my effort. When I was doing this full time, don't need a clinic. Don't need a billing agency. All you need is a car and a PowerPoint projector. I did splurge and have somebody to answer the phones, but it almost no overhead. You make a killing, and you're helping a ton of people. These are people who don't know about this risk and these disorders until they've got them, usually at the end stage of the disease process, where there's going to be a long, hard slog to fix them. We can catch up with them. And like when I'm introducing this to a HR manager at a company, I'm not really talking that much about injury. I'm talking so much about work pain, discomfort that limits production. We're going to teach people how to become experts on the working body so that they can get through a day's work, still have something left over to play with after work, and the company makes out with better production and much lower workers' comp costs. Meanwhile, the therapist gets paid well. Can't beat it.
Yeah, no, it was definitely, I was in a situation very much like yours where the company said, no, we're not going to do that. And I said, well, all right, I'll do it myself. And it's been, very lucrative. It's been nice and it's been seamless. It's been one of those things I don't have to really advertise. I just do it locally for a couple businesses here and there, and then word kind of spreads and people reach out and come to me. So I think if I were to advertise, I'd probably be in a lot of trouble because I'd have so much work to do. I wouldn't have the time to do it.
I've been there.
Yeah, it's a good problem to have for sure. But much like my mobile PT practice where I just see patients, locally, it's just friends and family and word of mouth referral at this point because I want to keep my hands involved. I do want to keep a little bit of patient care going, but again, it's strictly out of network, out of pocket, 100% cash pay, and it's only word of mouth referral at this point. So,
it's about the only way to stomach a clinical practice these days.
Yeah, it seems like it. I mean, I think the big picture is you've got to craft a business, whether it be a side business or a full-time business, around the lifestyle that you want. It shouldn't be the other way around. You shouldn't be living to work. You should, be working to live. And so I think in order to do that, you've got to find what is enough for you and then work around how do I get to that enough and kind of reverse engineer it. And this is, I think, a great way to go about doing that for sure.
And that's a great point because I know of therapists who treasure this specialty because their schedule is under their control. When I was doing this full time, I could take the month of November off to go deer hunting. I could take the summer off to go fly fishing. You can schedule stuff around the prevention demand, but you can't do that with patient care, especially I have a small town clinic and I'm the only show in town before I retired. It was pretty much impossible to take a week off.
Yeah, I mean, deer hunting, fly fishing, it's a rough life, but somebody's got to do it, So
yeah, exactly.
It might as well be you, right?
Yeah. Well, no, I retired from clinical practice 3 years ago, but my former clients would call me up and say, hey, I'll pay you $300 an hour to come in and do some more lectures. All right, I guess so.
Yeah, twist my arm, right?
Yeah.
Well, tell us a little bit about some tips or tricks or pointers you've learned along the way. Like you said, you've been at this for many years now. What if somebody's looking to get started in this and really looking to go at this as a business, a side business or a full-time business? What are some tips, tricks, or pointers you could give for those just getting started?
Well, your client base is going to be where your patients work. So it's real easy to identify not only target workplaces, but you can gather intel from the patient. Who do I talk to at your company? Who do I not talk to at your company? Or where can I make some progress on this? And can you advocate for me? Go to your supervisor, go to your HR and say, hey, Lauren's got a program here that can handle this problem. So that's one tip, is where do your patients work? The other I mentioned earlier, focus on the smaller companies. Don't get greedy and go after the 2,000 employee, mega factory down the street, because it's a waste of time. Let them call you. Let them call you.
I worked in Waco, Texas for a while there, right? And not too far up the road was SpaceX. They had a facility there in I think it was McLennan, Texas. And I was like, man, I should do this for SpaceX. And then I stopped and paused for a minute and I was like, there is no way I want that headache or that hassle, or like you said, the 2 years worth of waiting it out to figure out, how many board meetings and votes I have to go through to get approved. So I bailed on that.
And then when you schedule the work with them and you've got, say, 35 sessions of training you're going to do, and they call up the day before, say, well, we're having a production issue, we need to postpone it. All of a sudden, you're for a month. So it can kill you. So that's why
I love that. I love that tip, because it really, it was fun working with the mom and pop type operations, and they were all local too. So I didn't have to travel very far. I had a 30-mile radius tops.
One of the larger companies I did was Whitman's Chocolates down in Philadelphia. And I remember flying home on the plane afterwards, this great big cardboard box full of chocolate covered cashews. We passed it up and down the aisle in the airplane.
Yeah, that's one of the perks, right? You get to truly live the factory life a little bit and see, what they're producing and what they're working on.
Yeah. Now, probably one of the best tips I think I can offer on this specialty is don't make it complicated. If you start looking into ergonomic assessment tools, the ruler, the reba, the NIOSH lifting formula, all that stuff, they take those formats and make them so much more complex than they need to be. It's kind of like in physical therapy, taking a seminar on the sacroiliac joint. Is it an upslip, a downslip, torsion this way, torsion that way? How much of it is in your imagination? They just make it so complicated when all you got to do is lengthen the hamstrings and the piriformis. And anyway, that's another story. Yeah, but don't make it complicated. When I'm teaching therapists how to get into this, I'll teach them the ergonomics tools, the reba, the ruler, the NIOSH, the wisha. But I tell them what is better is to just take the pieces of each of those that are objective, reproducible, and put them into your own system. So what I've got is, what I use is a one-page checklist form, basically a checklist. Is there forward head posture? Is there shoulder flexion? Is there shoulder abduction? Is there external rotation? Are they forward bending? Are they sitting? What are they sitting on? Do they have adjustability in the seating or not? Are they standing on a cement floor? Is there vibration coming through the floor? Just a basic checklist. Is there gripping, pinching? Are they loading the ECR, risking tennis elbow? Things like that. And I focus a lot on posture. People call these repetitive motion injuries. I call them static posture disorders. It's not caused by the friction wear damage of repetitive motion. It's caused by a blocking of the perfusion of the working tissues due to sustained contraction, sustained postural loading. And it's real easy to fix those. If somebody is in prolonged sitting, have them work switching between sitting and standing. If they're in standing all the time, put a bar stool behind them so they can switch between sitting and standing. And then that's where the VariDesk came from, where you put your computer on a platform that you can pull a lever to bring it up where you can stand for a few minutes, then pull the lever down so you can sit for a few minutes. Posture variety. And rather than focusing exclusively on ergonomics, our primary competitors are ergonomics engineers who can't even spell declarations, but they go by the assumption that these are ergonomics injuries caused by poor job design, which means if we present the worker with perfect job design, the injuries go away. That doesn't happen because it's not the workplace. It's the worker's work technique, their posture habits, their fitness for work. What's scary is to go into a workplace and ask yourself, looking up and down the line, how many of these people here are physically fit for their job? That could be a scary question. So one of my bottom line trademarks on this is micro stretching, because if you've got a job where the ergonomics is terrible and there are no ergonomic alternatives to fix it, you've got two alternatives. You can have people rotate the job every 2 hours, so you're not doing it for 8, 10, 12 hours. You've got a different posture and a different pattern of movement every 2 hours. Or you can show them the micro stretches. So just a quick 10-second stretch to the scalenus, rotator cuff, ECR, pronator teres, hamstrings, extension, a 10-second stretch in 6 different muscle groups that the worker does whenever they feel discomfort. And you stop that chain of events of the worker deteriorating from fatigue to discomfort to pain to a workers' comp claim. You're going to get it at the fatigue and discomfort level simply by restoring perfusion to the working tissues with just a low load 10-second micro stretch. You're not actually stretching muscle tissue. You're placing the tissues on a tension to stimulate Golgi tendon organs, which are inhibitory in their response. The muscle relaxes, you get better perfusion. Now, that's wicked simple to us physical therapists. Plug in that simplicity to make it an effective prevention intervention. It's not that difficult. Nothing that I'm doing or teaching is real high tech, top tier physical therapy. It's basic stuff we graduated with, stuff we knew about when we were on affiliation, just packaging it into a presentation to teach to a classroom of workers. And the presentation, by the way, is almost identical to what I'm doing with a patient who comes in with rotator cuff disorder. Here's what you got to do about it for your job, your posture, your movement patterns, do your little Codmans every hour or so, things like that. Just what I'd be telling the patient, I'm simply telling the same things to people in a classroom, covering a lot of ground.
Yeah, and it's going on from that one-to-one model of treating one patient to one to many, where now we're educating 30 to 50 at a time, having a larger impact, hopefully helping to break that zombie workforce, and really show people. Even I've brought in a lot of simple things that I've had to work on personally, like hydration, staying hydrated, drinking plenty of water, sleep, getting 7 to 8 hours of sleep, right? Like when I was working on my dissertation, that was a farce. There was no way I was getting 7 to 8 hours. And I knew it. I knew it was a problem.
Yeah.
But as soon as it ended, I tried to work back to fixing that and getting 5 or 6, 6 or 7, 7 or 8, and now thankfully I'm back to a relatively normal sleep pattern again. But these are things that you don't even need the DPT. You don't need a degree in physical therapy to do a lot of this stuff. Yep. However, it certainly helps with a lot of the information that we know in order to put something like this together. And like you said, really package it into a one-stop shop to educate the masses then.
Yes. Yeah. Those are things that I'm constantly updating my presentation. You mentioned the hydration and the sleep. That's a new component that I'm really hammering on. Yeah. Last year it was pain science. You once you get chronic pain cranking, it's hard to shut it up again. Now, putting it in those words, once people understand, that the amount of pain is not reflective of the amount of damage, that motivates people.
Yeah.
And prevents those people who are sitting in the class. You've got every class you teach, you've got several workers in there who have a compensable injury, but they don't want to speak up. They don't want to go through the workers' comp BS system and really upset their whole lifestyle. So they'll pick up a few things that you get from that class. And then a couple of weeks later, you get a phone call from somebody who says, oh, by the way, that tip you gave me about, tucking your chin and stretching the muscles on the side of your neck, and my headaches are gone, that I had every day for years.
Yeah.
You do it.
It's amazing how much we can have an effect on people with just little tips and tricks like that. Because again, we know more than the general population does. A lot of the general population doesn't know about this stuff. They don't think about it on a day-to-day basis. So, well, Lauren, thank you so much, man, for just, having this kind of outside the box take on things, and on a great way that physical therapists can get involved in kind of a new direction. Thank you for being a mentor and for educating me on this stuff, and hopefully, obviously, my audience. And hopefully they'll reach out to you. Where can they find you online or on social media or whatever, if they want to just follow up and ask more questions or learn more about what you're doing?
Probably the easiest thing, Facebook, just search my name, Lauren Hebert. There's a bunch of them on there from New Orleans, but look for the one from Maine, me. My email address is lhebertpt@prexar, PREXAR.com. Just do a search, find me. And people, like today, I had 2 other therapists asking me about this stuff, and I just emailed a ton of materials to them to get them started. And I like doing that. Like I said, I'm retired now, and my mission is to get this to exist beyond my lifespan. I put a lot of work into it. It's doing a lot of good. I don't want it to go to the grave with me. I want as many therapists as I can to pick this up and as seeds and let it grow into some other stuff. And
absolutely.
Floors me, there are not enough people doing this. I don't know why. I mean, it'll save your butt from the insurance nonsense.
Absolutely. And I will drop all those links in the show notes, so we make it easy for people to find you. Again, Lauren, thank you so much for your time, man. And again, thanks for all your mentorship and education over the years. It's been fun, man. It's been interesting to learn this stuff because again, I think a lot of it is just about diversifying yourself, and learning the options that are out there to us. It's not just the typical clock in, clock out, 9 to 5 PT thing. Like you said, that's crumbling, man. That's struggling right now.
Oh, it's terrible. Just terrible.
Well, thanks, Lauren. I appreciate you.
Thank you for the attention to this. It needs to be disseminated.
Absolutely. And hopefully this show will do that for you, man. We appreciate your time.
Okay, thanks a lot, Scott.